Hi, this is Dr. Rudra Mohan, and through the Oral Health channel, let's talk about lycanoid reaction or lycanoid drug eruption. Let's start. So today we're going to be talking about lycanoid reaction, a very fairly common lesion that we actually see in the oral mucosa of a lot of patients. However, a lot of patients come up with two apprehensions, either it being lichen planus or it might be something related to cancer. So let me first tell you that without the honest and expert opinion of a dentist, you should not self-diagnose yourself about these things. Let me tell you something very honestly. Lichenoid reaction is predominantly an allergic reaction to either a foodstuff or a medicine or a medication or maybe a dental material, most likely in its case, that is causing a localized reaction or an eruption reaction in the oral mucosa at a particular atypical site where otherwise oral lichen planus would occur. At the same time, it is usually unilateral. That means, when we talk about oral lichen planus is generally bilateral. So if we talk about the buccal mucosa, that is the cheek mucosa, you will find that lichen planus typically occurs on both sides, right? But an oral lichenoid drug reaction or an eruption is probably going to be localized in one particular area, especially in an atypical area such as the lateral border of the tongue or the palate. And you will find that this has been happening for a short period of time and it seems to be not increasing in size. The chief complaint that patients report to us when it comes to an oral lichenoid reaction is typically a burning sensation, and they can see a whitish patch in the oral mucosa at an atypical site, where obviously they get concerned about if it's something related to the C word. But we have to understand that most likely it is an allergic reaction. Now let's talk about what lichenoid reactions are. They are typically allergic reactions which can be either caused by medications such as antibiotics, painkillers, non-steroidal anti-inflammatory drugs, anti-malarial drugs. At the same time, oral hypoglycemic drugs, that means any drugs that are given to diabetic patients, and beta blockers and ACE inhibitors as well. So a lot of patients who have these comorbid conditions and who have just started on a new regimen might encounter this kind of a reaction in a place in the oral mucosa where they feel that there is burning sensation which is exacerbated by eating spicy food. And obviously the main part about this thing, about the management, is the diagnosis. Secondly, you could have some very localized contact dermatitis or contact allergies that could happen, especially people who chew tobacco or who have recently changed their toothpaste or dentifrices, which contain flavoring agents which might cause some allergic reactions. At the same time, if you are chewing menthol gums or chewing gums or maybe just cinnamon for that matter. So obviously, if you're having a substance that is probably allergic to your oral mucosa and you're keeping it at that point, at one particular point, and it's causing an allergic reaction, you're bound to have a lichenoid reaction. And that's why we need to go back into the history, taking of you as to where we have to decipher what all have you consumed in the past few days, what has been your regimen about your diet, about your medications, and at the same time if you've changed your toothpaste. The third thing that can cause a lichenoid reaction is especially metal fillings such as amalgam. However, it's not being used these days, but then again, you have a lot of dental materials that can cause allergic reactions, and that will definitely give, for diagnosis purpose, we'll probably be able to diagnose it very fast if we can see a proper filling material right adjacent to the area where the lichenoid reaction has taken place. So the diagnosis ultimately depends upon, first of all, the history taking. Secondly, it depends upon whatever the area of the thing is. Obviously, we have to differentiate between oral lichen planus, and there are some ways. Also, we can make use of the help of the patch test, which helps us in evaluating if you're allergic to something already. And most likely with the presentation and everything, with our knowledge and everything, we can go ahead and give the diagnosis and manage the symptoms. Also, I would like to tell you that usually biopsies are not required in such a case until unless there is a non-healing ulcer there or something that is of more concern or could be of more concern. Coming to pain management, obviously we have to first find out what the thing is that is causing the allergy or the reaction. We have to stop that or use an alternative. For topical application, we can use a steroid ointment for that area so that it can heal till the time we are alternating or changing the drug or maybe changing the dental material that is associated with that contact allergy that's happening. So when it comes to prognosis, it's very easy. The lesion will cure within a few months and you don't have to worry about it. But as long as you are very aware of what you are consuming as a patient and what you're consuming as a consumer, be it whatever brand of toothpaste that you're using, it can cause the change in the toothpaste can cause any sort of a reaction or anything else. So you have to help us out in the diagnosis, and that way we can work together to make sure that your symptoms and your disease process is alleviated. So this was today's episode. Please like, share, subscribe, and please press the bell icon button so that you can get important updates. Here are my social media handles. Let me please remind you that I might not be able to come on call directly. Please leave me a WhatsApp message with your name and your location so that we can coordinate if it's something in a different time zone. And please don't mind me when I say this, because I might not be able to pick up your call because I either might be with a patient or I might be busy otherwise. So please like, share, and subscribe. Have a nice day.